To understand the complications, we need to take a closer look at the major arteries that run up the nose. And so we have the facial artery, the superior labial artery, the angular artery, the dorsal nasal artery, and the lateral nasal artery. And the common theme behind these arteries is that they can be connected back to the dorsal nasal artery. And so what that means for us is that if the filler were to enter any of these danger zones, there is a chance the filler can go back to the dorsal nasal artery, enter the eye, and cause blindness. So you might be thinking that this middle portion right here is the safe zone, and you would be partially correct because there is actually another artery known as the radix artery connecting the left and the right dorsal nasal artery. And filler into this area can actually cause bilateral blindness. But of course, there's a way to avoid all this, and that is injection depth. So again, staying central is part of the solution, but the injection depth plays an important role, and where you want to be is as deep as possible. So let us take a look at the layers of the nose and see where that might be. So first of all, we have the skin, and then we have the subcutaneous tissue, and this is where the arteries are. Under that, we have the muscle, a space, and then the perichondrium. The perichondrium is a dense layer that covers the bone or cartilage. So as long as you inject into the perichondrium, which is right here, you are safe. So finally, we can go over who an ideal candidate is. And over here, we have a previous candidate. And so what we do is we locate the radix, which is centered right here. And we have to check to see if it's in line with the eyelashes or the tarsal fold. And so for this candidate in particular, her tarsal fold was in line with the radix. And so the doctor goes in, she goes in deep, hits the bone, and starts injecting onto the nose.